Hello, everyone, and welcome to today's webinar, which explores the burden of kidney disease on women. My name is Luyanda Majija, and I am your moderator. Chronic kidney disease is one of the fastest growing public health concerns of our time, affecting roughly 850 million people worldwide. It's 850 million people, young and old, who are members of our families, our communities, and society at large. Yet despite its high prevalence, it often goes undetected until it's reached advanced stages. In many cases, women living with chronic kidney disease are more adversely affected due to a range of biological and social factors presenting uniquely to them. And as the month of March marks both International Women's Day and World Kidney Day, this webinar presents a critical moment for us to pause and reflect on the distinct kidney health challenges that women face. And so joining me to make these much needed reflections is a panel of experts in kidney patient advocacy, clinical care, and scientific research. I'm joined by Professor Roberto Paparfelio, who serves on the Global Patient Alliance for Kidney Health Medical Advisory Council. He is also a senior researcher at Arbor Research Collaborative for Health and a professor at the Catholic University of Parana State in Brazil. Also joining me is Deborah Duval, who is managing editor at Kidney Care UK, as well as Gisela Delgado, who is brand creative director of IgA Nephropathy Foundation in the US. Deborah, Roberto, and Gisela will give us some insight into how kidney disease truly impacts women. They'll help us to uncover the various barriers to effective kidney care and highlight the policy-driven solutions we need to tackle them. This webinar is produced by the Global Patient Alliance for Kidney Health in collaboration with the Partnership for Women's Wellness. The Global Patient Alliance for Kidney Health is a collective of over 40 patient advocacy organizations working together to make sure that people living with chronic kidney disease have timely access to screening, early diagnosis, and treatment. For more information on this collective, please visit globalkidneyalliance.org. The Partnership for Women's Wellness is a newly established global advocacy coalition committed to making women's health a top priority and not just an afterthought. It shines a light on the impact of conditions like kidney disease, as well as chronic inflammation and obesity, and uses stakeholder collaboration, awareness raising, and policy engagement to expand access to prevention, screening, and early treatment for these conditions. To learn more about the partnership, please go to forwomenswellness.org. We'd love to hear from you, our audience, so please make use of the Q&A function throughout the discussion to submit any questions or comments you might have to help us further unpack this. Deborah, welcome. Let me start with you here. There are several aspects of women's health that can influence the progression of chronic kidney disease. And so, drawing on your personal experience with the condition, can you please share some insight into what some of these unique challenges are that make it almost impossible for women to manage this disease? And while you're giving me your reflections, and also share what you would say the health system's gaps are that worsen these challenges.
Okay, thank you very much. Thank you very much for inviting me to speak at this webinar. It's a really important topic and one that's very, very close to my heart. So I am a woman in kidney failure. I am the other side of 4 transplants, and I'm about to start dialysis again, waiting for my 5th transplant. I still work full time. I'm past retirement age, and working is one of those challenges that I would suggest. So I work for Kidney Care UK, so there's no surprise there that I work for a very understanding employer, and my many, many, many hospital appointments are completely accommodated. I'm never made to feel guilty. I don't have to take that time out of holiday. Whatever I need by way of medical support, they allow me that time. So I couldn't work for a bank. I couldn't work for many, many employers. For many years, I had to be self-employed, and that came with its own risks. But now I have the security of employment. despite being past retirement age, I choose to keep working. So I think there's a unique challenge there with employment, and you do, as a woman, you do need to explain this to employers, and you might not be speaking to another woman. So you have to explain that, I will give you 150% of me and I will work hard and I will deliver, but I will need this time off. So let me tell you what I have delivered. 27 years ago, I created a magazine for kidney patients. We had no internet, no Facebook, no nothing. We have 28,000 signed up readers in the UK here. And then 8 years ago, I set up a project called the Kidney Kitchen, where we took creative chefs, dietitians, and I could not eat the food that dietitians were recommending that I ate. So we took all food and included it, even the food that is higher in potassium, in our meals, but made those meals safe for kidney patients. And last year we welcomed over 480,000 people to the website, the Kidney Kitchen website. We published 6 recipe collection books, and I lead on all of those projects. So work has been very important. I am obviously more than a kidney patient. I do not have children, and I would suggest that that's a massive gap in our understanding. My biggest sadness is that my kidney disease at the time, because I'm older now, so there are some younger women coming through the system now who are successfully having good pregnancies and well-supported deliveries, and they're having children, and that pleases me, because that was not something, the moment I mentioned that, it was an absolutely no. You will never become pregnant successfully. If you do, your baby will die, or you will die, or both of you will. So I'm glad to see that that is changing. Much more work needs to be done in that area, and that includes expanding that into relationships and support through some very difficult times in relationships. I am divorced, and I put some of that down to my kidney disease. It's a very, very difficult thing to watch your partner go through. Dialysis is traumatic. It's severe, upsetting. It is bloody. It is time consuming. It involves periods of extreme exhaustion. And if you've got machinery in your house, then that also occupies a lot of your domestic life. So I think pregnancy, personal relationships, family planning is an area that is beginning to expand in terms of knowledge available to we women with kidney disease, chronic kidney disease. There's a lot to be done. And I think past my time, in 20, 30 years' time, we have sown those seeds, and those seeds will have grown into something that will flourish. And then my third point is I want to look like a woman. So some of the drugs that we are prescribed, and I have refused to take, by the way, I absolutely won't take anything that changes my physical appearance, that will make me gain weight, make my hair fall out, give me swollen gums, give me a hairy face. I'm afraid, for me personally, that's a no-no. And I have spoken to R&D departments of drug developing companies and have been asked some fairly basic questions, like what would I want from the drugs I take to suppress my immune system? And I've had to ask a question back and saying, am I the first patient you've ever met? And a room of 300 R&D people, and they've nodded their head and said, we've never met a patient before. And that is madness to me. So for my future selves, the women that are coming through the system now, who want to work like me, who want to have a productive life, good, healthy relationships outside of their kidney disease, then I would ask the drug companies to look at some of the side effects that the drugs they give us, and modify those so that we can hold our head up high, and we don't look like a patient. I don't want to look like a patient. So I understand I'm going to have a neckline. I understand all that. That's going to keep me alive. But don't then give me drugs that balloon out my face, make my teeth and my hair fall out, give me bleeding gums. I don't want any of that, and I won't take them. So that's my contribution. I hope that's helpful. I'll take any questions. I am really, really reassured to see that there are organisations like this tackling this major problem in our health system. Thank you.
Thank you, Deborah. I'm not letting you go just yet, so please stick around. Thank you for sharing your story. I've never really heard the struggle of kidney disease described as something that causes severe emotional distress. I mean, you see it read on a piece of paper, but the way that you elucidated that is really, really important for us to think about. It's not just something that affects your body biologically, anatomically, physiologically, but it also has a huge emotional and social toll on the people affected by it. Roberta, moving on to you, awareness of chronic kidney disease remains alarmingly low. I'm always shocked when I hear the statistic, but less than 10% of people who have CKD know that they actually have it. Uh, Even more shocking was the fact that awareness is even lower among women. What does clinical research tell us? How does clinical research, explain this phenomenon, and why do such inequities in diagnosis and treatment exist based on your expertise?
Yeah, thanks, Lilian, and thanks for the opportunity of being here. I feel privileged to be around women talking about women health and women kidney health. And Deborah, thanks for sharing this testimony. It's very touching, and I think it brings some very important issues really related to the full burden of kidney disease on from a perspective of a woman. You're right, Luana. I mean, awareness is a big problem in general, but I think women suffer a little bit more when it comes to not only being aware, but perhaps being included in this whole process of the research that it needs to be involved to bring innovation, to bring new options. I'm going to give you a couple of examples of this that I've been feeling very strongly as a nephrologist and as someone that is really involved in the ongoing studies for new treatments. For instance, there is a clear underrepresentation of women in clinical research, and very clear. I mean, we are fighting very hard. People involved in leadership of clinical trials are fighting very hard to offer the opportunity for women to participate, because I think if they are aware of the ongoing efforts to bring innovation to the field, I think they will join. And I think they've been excluded in communication and not given enough opportunities to participate, both in clinical trials or studies of drugs and things like that, but also more in general in research. I think, for instance, information about women kidney health based on observation on epidemiology or epidemiologic studies and registries is underrepresented. And I think this has a major impact on the way that we understand kidney disease in general, because, and that's a segue to the second point I wanted to bring, and that is the fact that women biology is different, and there are sex-specific pathological mechanisms in kidney disease. You know, a lot of these diseases that are causing chronic kidney disease are immune-mediated or inflammatory as in principle. And women, through hormonal differences or biological differences, they are exposed to changes in the way that disease manifests and progresses. So if you don't have representation of women in clinical research, you're missing a big piece of the understanding of mechanisms of disease. And I think we need to continue fighting to really include women in clinical research, or offer opportunities for women to participate in clinical studies. And I'm sure that there will be better representation in the future. The second point I wanted to bring is actually related to disparities in access of care that I think are very clear. This is also part of my own research. We studied that in settings like dialysis initiation, transplantation listing and delivery, and also access to chronic kidney disease care. And in all of those settings, women seems to have less access to opportunities for better care. For instance, they are diagnosed later, very clearly late diagnosis compared to men. This might have something to do with the way that the women deal with symptoms of disease, and they search for help, sometimes maybe trying to, trying to avoid, like bringing things up in a different way compared to men. Doesn't really allow, disease to be recognized. And I think there's also a healthcare worker lack of awareness that women are exposed to the same risk factors for chronic kidney disease, for instance, compared to men, and don't think about that as much as they do for their male counterparts. So that reflects in less diagnosis and later diagnosis. And later in the course of disease, also very clear from our studies that women are offered initiation of dialysis in a different way compared to men, and have a lower chance of being transplanted, which is actually the best way of treating advanced chronic kidney disease. So I think in concert, all those things together, we are really looking at disparities in access to research participation and access to best care for women. And this is something that needs to be raised as an important focus of discussions or organizations and policy and people that are really defining the best CKD care in the world.
Thank you, Roberto. I think you've done a great job demonstrating that there's a through line from research all the way to clinical care. And the research aspect ties in really well with what Deborah mentioned, which is that companies are conducting R&D also need to have women's needs in mind when they design drugs to help treat chronic kidney disease. So thank you for your contribution. Gisela, moving on to you, we can't talk about chronic kidney disease without zooming in on rare kidney conditions like IgA nephropathy. What specific challenges do women with rare kidney disease have? And can you think of any systemic barriers that make it even more difficult for them to manage their rare kidney disease?
Yeah, thank you for having me on this panel too. And Deborah, I'm also a kidney transplant recipient. I was diagnosed with IgA nephropathy over 30 years ago. So right at that sweet spot of kind of going into about 13 or so. And I think when we think about with women and treating like women's whole health, I think, and what I've noticed, I've been working with the foundation for about 7 years, is that when you have a kidney disease, but maybe you're not following up with a nephrologist or specialist care, it seems like no one knows enough about kidney disease and things of things you should be looking out for. And I personally experienced this because I was diagnosed so young. I fell out of care for a bit. Then I was like an adult and seeing a bunch of other doctors, but not necessarily a nephrologist. And it was always when I would bring it up to like an ENT or because I would have a lot of upper respiratory infections, or I'd bring it up to a GYN, appointment. And the first thing everyone would say, oh, were you ever on dialysis? And I think there's a big misconception about kidney disease and all the things that it does to the body, and especially like Roberto says, like it really impacts the whole woman's body and hormone health. And a lot of women, you're told you have this disease, and then first thing as a woman, there's just like this trajectory of like, oh, does this mean I can't have children? Should I even worry about children? Is that going to make my life worse? And I was told something very similar, that it'll be very hard for me to think about having children. So you should probably put that out your mind and just focus on, ultimately one day you might need a transplant, and that did happen. But it's very hard to speak to a doctor that's not a nephrologist about what you're feeling. And I also feel that one of the issues that came, I actually did a little survey with the foundation. We have a private women's group that we've built over the past couple of years, and is really focused on women with IgA nephropathy that are focusing on they just want to know how to navigate the system as a woman, but also with family planning, because you're told no more than you're told yes, or it is possible. And a lot of women say it seems like when you get diagnosed with a rare disease, the only thing they tell you is they're only focused on limiting your kidney disease, but then not talking to you like a person that might have other things. And that's where it becomes emotional. And you do have to push back, and that power dynamic in that 15-minute appointment um, can be very overwhelming as a woman in front of a doctor. Like, it's okay for me to ask, but what if? Um, and I can resonate with that. I also push back on not being put on prednisone post transplant, because I asked my doctor, would it be able, like, is it actually going to help, or is it a maybe? And I don't think I would have done that if I wasn't in the advocacy space. I think that that a lot of barriers that exist in this space is that the woman's voice is usually not included as a she's not in the room when decisions are happening on how we're going to talk about her disease. She's not in the room when um, we're deciding that, oh, these symptoms are going to be dismissed because they're probably just related to your menstrual cycle or part of aging out. A lot of women have concerns of, what is this rare disease going to do to me? We already know that menopause is a thing, but what does it mean to have a rare disease and have menopause? Like, where's that book? And there's just a lack of resources that seem to be coming out, and most of the material that is out there, the general consensus is that it's people talking at people, but like the patient voice is missing. A lot of material is not in layman's terms. It's very hard to understand. Even sometimes you'll see like studies and research, and you're trying to gather, especially in this world of Google, and you can, now AI, it's still very hard to process what's happening as a patient. And another thing too, going back to kind of what Deborah said, um, the female specific challenges, that if you don't have kidney disease and you're trying to talk to your girlfriends about it, like, they don't understand it, especially if you don't look sick. So unless you have a fistula, or you're going to dialysis, or maybe you have the moon face from the steroid therapy, you might otherwise look fine, but you literally feel terrible. And it's really hard to build a sense of community. And I've met a lot of patients over the years that, specifically women, that burn themselves out because they're trying to just fit in, and pretend like everything is okay. And it can feel very isolating when you can't eat certain things, and you need to find your people. And that's, I love what I do with the patient advocacy work, because we're letting patients find a voice and find their community. But I think if I go back to, like, I'm just looking at the question, like, the biggest things that exist in this space that I think is a barrier for women is that it can feel very isolating. And I don't know that we're doing enough to make women feel empowered, that they do have decisions, that they can seek second opinions, they can go find community. And the biggest thing also, like you mentioned, these statistics, like, I'm not the only person with kidney disease that happens to be a woman, but why is it so hard for us to find each other? And how are we actually amplifying that? So, I mean, a lot has been done, and I'm grateful for this organization and the Women's Alliance. I think that's going to be great. We've got a lot of excitement around that, but it just also, it feels safe. And when you feel safe to use your voice and people feel educated, it's a trickle down effect. Like, I'm doing a lot of work now that I can't benefit from, but like, I know future women will, and that makes me feel good. And that's the general sense, I think. Um, it's not just about, we focus a lot on women and fertility, but I think it's just like women in whole hormonal health, and understanding, like, you don't learn about the kidneys in that way. We know a lot about the heart, we know a lot about the lungs, but there definitely needs to be more PSAs, I think, about kidney health.
Thank you, Gisela. I feel like you, Deborah, and Roberta had a pre-briefing meeting before this, because you all spoke on one accord about inclusion of women's voices in R&D research, in general clinical research, and also in patient rooms where they're consulting clinicians and nurses. It's disheartening to know that in 2026 we're having to speak about the need to include women, so that we can make better decisions about how to care for them in the best way possible. I'd like to invite our audience to please share their questions and comments in the Q&A box on your screen. And while you do that, I want to move us from discussing, highlighting the problem, and maybe talk about some of the solutions. I know that you've alluded to some of them in your earlier responses, but can you please share, what health systems can do to improve women's access to early diagnosis and treatment? If you may, you can pick among you who answers this question. I'm happy to have this be a long conversation.
Yeah, maybe I'll get us started with that. I think it's, first of all, is being convinced that this is a priority. I think needs to, women health needs to move up in the policy agenda, in the policy makers' agenda. It is not. And I think once you do that, and once you look at the data available, you'll be so clear that this is something that is so important and unequal at the moment. And I think in a world that really tries to bring equity to the center of what we do in healthcare, I think women's health is one of the most important ones, and it needs to be really needs to move up in the agenda. Data is there to support, and I think there's enough motivation in the drivers of the process. I'm talking about clinicians. I'm talking about healthcare workers that are involved in this to really do something about it. And I think it is a question of priority in the policy agenda as the first step. The rest would flow naturally.
Excellent. Thanks, Roberto. Gisela, Deborah, would you like to add to that?
Deborah,
yes. Well, I absolutely agree with that. I think there's a very strong, powerful argument for more very early testing to be done. So in the UK, for instance, when we go to the GP, and it was my GP, my general practitioner, that's primary care in the UK. So secondary care is hospital, primary is you're going to your local doctor. So it was my local doctor that identified my own kidney disease, and my function was below 30% by the time it was identified. Well, as somebody with type 1 diabetes, I've been going to the GP. I've been part of the secondary care system for many, many years, from the age of 11. And at no point did anybody say to my parents or me, well, your kidney disease is declining. What can we do about it now to reverse this process? So I think certainly in the UK, and I don't know how this pans out across Europe and the USA, but certainly I think that early stage identification. I just shared a poster, our Bloody Amazing Kidney campaign. I think that if GPs, if early stage detection, so whatever the mechanism for that is, in the UK, it's the GP, and you go in and you have a regular blood test for whatever. You've got heavy periods, you've got headaches, you're suffering with depression or whatever. But if it was a normal thing to have a blood test and for your kidney function to be tested in that blood test, so that somebody could say, right, your kidney function is declining, you need to pay attention to your diet, you need to stop drinking, you need to stop smoking, you need to go and get some exercise, we would not have as many people in end-stage kidney disease. Now, Gisela and my kidney disease was almost inevitable. Mine was diabetic nephrology and IgA nephropathy for Gisela, so maybe that was inevitable. But there's a huge percent of people across the world, I have to assume, that have kidney disease as a result of poor diet, no exercise, drinking, just a poor way of life, and not a healthy way of life, and a short, sharp shock. By the time you get below 50%, say you could end up on dialysis, or you could turn this round. I honestly think that would revolutionize the approach to kidney disease, and that is about raising awareness. Thanks.
Thank you, Deborah. Gisela, I'm going to challenge you because you spoke about the need to empower women who are living with kidney disease. and ask you, how would you say patient advocacy groups like IgA Nephropathy Foundation, like Kidney Care UK, can support women to prioritize their kidney health by understanding the risk of kidney disease and seeking intervention?
I think the biggest, like in advocacy, you believe what you see, right? So like we use a tagline that says you are not alone. Or your doctor might even say like, oh, don't worry, like people get treated like this all the time. But something about patient advocacy, when you can see someone like, I'm inspired by Deborah having more than one transplant, still working, like seeing is believing, and she's still doing stuff. Like that's very inspiring for me. When I meet someone that's 30 years post-transplant and doing well, or more recently, when you're meeting someone that because of it was caught early, they're not suffering. Yeah, it's like fantastic, right? And then now we have like new drugs that are coming on the market. But I think what patient advocacy groups do is a lot of times we just kind of nod yes in the doctor's office. We feel there's a power dynamic there. And you could be the nicest doctor. It's just something that exists in this world. And we're like, uh-huh, uh-huh. And what what I always try to tell patients and caregivers is like, when you have that appointment, do you understand why you're going to this appointment? And we have like a little worksheet we made. It's like questions to ask on your next appointment. Um, and there's a list of it. I think it's about empowering people to feel like they have a voice in the care, and that it's really important for them to understand why they're being put on a drug, why they can't do certain things, and that they're not just there's like a checkbox that the doctor's doing. Because I mean I personally I'm very lucky. I've met over 400 IgA nephropathy patients in my lifetime now, and not two people are being treated the same way. And that is interesting. And why is that? Because you have to treat the individual, and it can really feel like you're just a number in the voice. And um, so the question about like me pushing back on my doctor with prednisone was because before I had my transplant, they tried prednisone for a course of 6 months and it did not help. So after transplant, when they asked me, okay, we're typically steroid free, but because you have IgA nephropathy, we'd like you to be on prednisone. And I said, why? And then they said it may or may not help. And I was like, well, do I have to do it? And they were like, no, but if we see signs, then we'll ask you to be put on it. And I said, okay. The risk factor there was me. I was like, what are my other options? I'm very fortunate to be a very well-educated patient and in this space, but that's not the average person. And patient advocacy groups help put things in layman's terms, and I call it we put power in people's pockets. We create a lot of little guides, questions to ask. If you don't understand a term, feel empowered to be able to ask those questions.
Gisela, and really I encourage everybody on this webinar, everybody listening, to commit themselves to putting power in people's pockets. I love that message. And thank you also for answering the question from our audience member who asked about prednisone. I think that was very, very helpful. There's a lot for us to take away from this conversation. 30 minutes is nearly enough to unpack this topic, so I encourage everyone to visit the websites of the panelists on this webinar. They have a lot of resources for you to wade through, and also please let us know after this webinar if there have been questions for us to direct at them, and we will follow up. So perhaps just to bring it all together, I wanted to say that, low awareness, it sounds like limited screening, that far too many women are diagnosed with kidney disease after their kidneys have suffered severe damage. And at that stage, that treatment options are more complex, more costly, and less effective. Health systems have a mandate to address the unique challenges that female kidney patients face. So we have to make sure that they're optimized through thoughtful and evidence-based policy design that keeps women's needs in mind to give women equitable access to early detection and life-saving treatment. Let's also remain mindful of the fact that these systems are not abstract ideas, right? They are made up of infrastructure and people who run them, right? Doctors, like we've discussed already. And so it's important for us to support these individuals so that they are able to deliver a high quality care that centers the unique needs of women. But even the strongest and most efficient health system falls short if the women living with kidney disease are disempowered. So we have to be thoughtful strategic about how we share information, resources like the checklist you mentioned, Gisela, to enable them to seek early intervention and advocate for themselves when they at the interface of clinical care. It's important for us to act with a sense of urgency to improve kidney disease awareness, diagnosis, and treatment for women, because having healthier women mean that we have stronger families, thriving communities, and more resilient societies. And so thank you so much, Roberto, Gisela, and Deborah for sharing your time and your valuable insights. And to everyone for joining us from all the world, we're glad that you could be here. We hope that you found this discussion as valuable as I have found it. You'll each get a recording of this webinar, and I encourage you to share it with your networks and use it to inspire conversations about how we might improve the way that we support women's kidney health. Please visit globalkidneyalliance.org and For Women's Wellness to get more in-depth information on today's topic, and be sure to follow the Global Patient Alliance for Kidney Health and the Partnership for Women's Wellness on LinkedIn, Facebook, and X for real-time updates on upcoming webinars, events, and presentations. See you at the next webinar. Thank you. Bye for now.
Yeah.